Hey guys, welcome back to my channel Medico Kunal. This is my second video, and this video will be about the United States Medical Licensing Examination, which is USMLE. So let's start. So let's first discuss what is USMLE. USMLE, or United States Medical Licensing Examination, is an examination for medical graduates to obtain license to practice medicine in the United States. I will explain. USMLE is an exam which is a licensure exam for the medical graduates to obtain license to practice in the United States, and it also helps in getting PG residency seat in the USA. So it is a three-step examination: Step 1, Step 2 CK, and Step 3. Before 2022, there were four exams: Step 1, Step 2 CK, Step 2 CS, and Step 3. Due to COVID reasons, Step 2 CS is not there. So let's discuss the USMLE Step 1. This exam is usually given at the end of the second year of med school. Preclinical subjects are tested in this examination. It means this exam usually covers the subjects of the first 2 years of medical school, which are the basic subjects like anatomy, physiology, biochemistry, pathology, pharmacology, microbiology, and so on. The cost of exam is $1,155. The following are the subjects which are tested: anatomy, which covers embryology, general anatomy, gross anatomy, histology, and genetics; physiology, biochemistry, pathology, pharmacology, forensic medicine, biostatics, community medicine or public health science or epidemiology, and microbiology. In India, usually the subjects are covered separately, like anatomy, we study separate, physiology separate, embryology separate, pharmacology separate. But in outside India, the subjects are covered in block system wise. Like first, we take cardiovascular system. So in cardiovascular system, we study embryology, anatomy, physiology, biochemistry, pathology, pharmacology. Everything related to cardiovascular system is studied all together. So, in USMLE, the above subjects which were discussed earlier are covered as block systems, which are as follows: cardiovascular system, endocrine system, gastrointestinal system, musculoskeletal, skin and connective tissue, respiratory system, reproductive system, renal system, neural system, psychiatry, oncology, hematology, biochemistry, and behavioral science. So let's discuss the exam pattern of Step 1. Step 1 is an 8-hour long paper consisting of 280 MCQ type questions. It consists of 7 blocks of 1 hour each. Each block will have 40 MCQs. There will be a 1 hour additional time. In 1 hour time, 15 minutes is of orientation and 45 minutes break. If a students attend orientation before the exam on NBME website, then those 15 minutes will be converted to break. So 1 hour break time, I will explain. Usually step 1 is an 8-hour long exam. Out of 8 hours, 1 hour is the additional time and 7 hours is the real examination time. The 7 hour is divided into 7 blocks of 1 hour each. Each block is of 40 MCQs. So total MCQs are 14 to 7, which is 280. And the 1 hour time is divided into two parts: 15 minutes orientation and 45 minutes break. If a student attends orientation before the exam day on the NBME website, then that 15 minutes will be converted into break. So total 1 hour break time. So 1 hour break time can be utilized by student in between the 7 hours. So it is a very important change that happened in the 2022 step 1. So from 2022, step 1 will be a pass or fail exam. The passing marks is increased from 194 to 196. It will no longer be a 3-digit numerical score examination. So, till to 2021, the step 1 was a 3-digit numerical score exam. On that score, we would get the PG seat in US. So, from 2022 onwards, it will be a pass or fail exam, and the passing marks have been increased from 194 to 196. Some of the best resources for preparing for USMLE Step 1 are the Boards and Beyond, which are the main video series, U World Question Bank. It is the main question bank for the Step 1, and its 3-month subscription is $369. First Aid is one of the best books for preparing for USMLE Step 1, so the first aid will cost around $51. Pathoma, which is also a good book. Sketchy has picture mnemonics and it will cost $269. So let's discuss about USMLE Step 2 CK, which is clinical knowledge. The USMLE Step 2 CK exam is usually given during the last year of med school. It tests the clinical knowledge of a student. So basically, the subjects taught in the third and fourth year of med school, which are the clinical subjects, are tested, and the cost of exam is 1175 US dollars. The following topics are tested: internal medicine, gynecology, pediatrics, ophthalmology, surgery, oncology, radiology, dermatology, orthopedics, anesthesiology, and ENT. Let's see the exam pattern. It will be a 9-hour long exam consisting of 8 blocks of 1 hour each and 1 hour of break. In total, there will be 320 MCQs. In 1 hour time, 15 minutes is of orientation and 45 minutes break, like the step 1. If a student attends orientation before the exam on NBME website, then those 15 minutes will be converted to break. So 1 hour break time. It means that the paper is of 9 hour long. So out of 9 hour, 1 hour additional time, like in the step 1, and 8 hour examination time, divided into 8 blocks of 1 hour each. So if the base or step 1 is strong, then this exam will be easily cleared. This will be a numerical scoring examination. So instead of step 1, step 2 CK will be a numerical score examination. If the base or the preclinical subjects are strong, then this is a piece of cake. You can easily go through this examination. Some of the best resources which can be used for this exam are the UWorld main question bank, which I earlier discussed, the Boards and Beyond, which are the main video series, Divine Intervention podcast, which is a free, and Boss Library. Usually for Step 2 CK, first aid book is not preferred. Embossed library is mostly preferred. So let's move on to the last step of USMLE examination, which is step 3. This exam is not a requirement for the match, but some of the IMGs, which are the international medical graduates, give this exam before the application for residency program to raise the chances of getting the residency program. Many give this exam in PGY 3 year of residency. This exam must be given before completion of PGY 3 year of the residency program. This exam tests the academics and the character of a student. This exam is an artificial stimulation of patient cases. So it basically means that most IMGs, which are the international medical graduates, give this exam before applying for the residency program so that the chances are increased to get the program in the USA. But this exam must be given before completion of third year of the postgraduate residency. And this exam not only tests the academics but the character of a student. So it is a 2-day examination of total 16 hours and the cost of exam is $895. Eligibility for step 3 examination. So these are the basic eligibility criteria for the giving the exam. So the student must have a medicine degree, an ECFMD certification, which will cost around $1,000, and you must be step 1 and step 2 CK qualified. Exam pattern. On the first day, the exam is a foundation of independent practice, which is a 7-hour long exam. 6 blocks, 6 hours, and one block of 1 hour each. Total 232 MCQs. In 1 hour time, 15 minutes is of orientation and 45 minutes break. I discussed it earlier and the same pattern goes. In step 1, step 2 and step 3 the 1 hour is utilized in the same way. So I'll explain on the first day. 7 hour long exam. Out of 7 hours, 6 hours examination time, 1 hour additional time. 6 hours, 6 blocks, and 1 block is equal to 1 hour. So and 232 MCQs divided into 6 blocks. And the 1 hour additional time, 15 minutes orientation and 45 minutes break. The second day, advanced clinical medicine plus CCS cases. Total time is 9 hours, 180 MCQs, divided into 6 blocks of 60 minutes each, plus 13 CCS computer-based case simulation cases, which are 10 to 20 minutes each. So, on the second day, the exam is of 9 hours. Out of 9 hours, 6 blocks of 1 hour each. So 180 MCQs divided into 6 blocks and plus the 13 CCS cases, which are 20 to 20 minutes each. We have come to the end of this video. I hope you liked this video. So like, share, comment on this video and subscribe to this channel. Next video will also be based on the USMLE. So stay tuned.